Good morning and welcome to the Tri-Valley Chamber of Commerce, webinar number 8 with Alameda County Public Health Officer, Dr. Nicholas Moss. Before we get started, I'd like to introduce my neighboring chambers of commerce who are co-hosting this with me today, and that is the Dublin Chamber of Commerce and the Pleasanton Chamber of Commerce. And for some opening comments, I want to introduce Inga Houston, who is the CEO from the Dublin Chamber of Commerce, followed by Steve Van Dorn, who's the CEO for the Pleasanton Chamber. Inga, welcome.
Hi, good morning. Thank you, Dawn. And I'd like to take a minute to say thank you to Amos Productions and Dr. Moss for coming and joining us again today for our number 8 event. And we look forward to hearing about what's going to be our new rules and regulations, as well as, good morning, Steve.
Oh, you're muted, Steve.
I do this every time. Dom, thank you so much for including us and pulling this together. Thank you, Dr. Moss, for being here. And of course, Jody, for your support. The voice of God behind our scenes here to keep us on track. And I really hope we have a really good discussion with our members that are tuning in. So we look forward to hearing your questions and comments, and let's get started. So thank you so much.
Okay, thank you, Inga, and thank you, Steve. Before we get rolling, a couple of housekeeping matters. We are taking questions. The program is for an hour and a half. Dr. Moss does a brief presentation at the beginning, followed by probably almost an hour of Q&A. So please enter your questions into the Q&A feature on your screen there, and we'll follow up with those after his presentation. Also, as we are well aware of, as we operate in the virtual platforms, still, for the time being, every now and then we do run into some glitches. And if we do, just be patient. We may freeze up, we may have to log off and log back on again, that being the presenters. So just continue to stay tuned, and we'll be back to you just as soon as we can. So getting started with our program, on behalf of the Livermore Valley Chamber of Commerce, I just want to express some really sincere thanks and appreciation to Dr. Moss and the Alameda County Public Health Department for their partnership over the last, we've probably been doing these webinars with them for nearly a year. Having that connection and access to information directly with our public health department has been crucial to helping us navigate the uncertainties of conditions on the ground, whether it is with the effects of COVID-19 upon public health and trying to manage all of that, or the economic impacts to our businesses as they try to pivot and respond to the various restrictions over the past 14 to 15 months. So it's just been really important to our members, our member businesses, and we hope that when we are done with this pandemic, we may have one or two more webinars after this one, who knows, we'll see, that we will continue to that partnership with our public health department, because I think that one thing that we've come to realize is that this agency, this department, plays a really important role in our economy, and we must remain connected with them as we move forward post COVID-19. So with that, I'd like to introduce Dr. Nicholas Moss, who is our public health officer for the County of Alameda, so we can hear what the latest news is from him. And I'm happy because this webinar, I know we have some very positive news that we're looking forward to hearing. And Dr. Moss, welcome.
Thank you, Don, and my thanks to all the chambers for having me back here. It's great to be back. It's been a year with a lot of difficult times and some better times. This is definitely one of the better times, but I think also a confusing time with all the changes in regulation coming again. So glad to be here meeting with your constituents to discuss what's going on. As you can see, I picked my most glamorous background for today. I like the casual look here of the home office. So I hope people don't mind that. I prepared some slides that we can start with, and then jump into the full discussion, which I'm sure will be very rich. So this is, I think it's been a while since I've showed any slides here. This is a slide that just shows the number of new cases diagnosed and reported to the health department by day. This just goes back to August 1st, where you can see there's that big surge in the winter. We had tons of cases, up over 1,000 reported every day on the worst days. And you can see in the last few weeks, very low levels of case reports, as low as we've seen really at any time during the pandemic. And we still have quite a bit of testing going on. So this is a very good news. Next slide, please. So this is the last week of case rates from across the country. Darker blue is worse, and you can see plenty of COVID out there. The whole country as a whole is on a downward slope. Most of these states saw spring waves that are now easing up. But you can see California much better off really than the whole country through the spring wave. We had a little bit of a spring ripple here in Alameda County. We did see some people in the hospital and some associated deaths. We weren't totally unaffected, but on the whole, it's been very quiet here through spring and really across the state. Next slide, please. The reason we're here really is because of vaccination, but also I think because we were hit hard in the winter, and we have some natural immunity out there as well. With the progress on vaccination allows us to think where we're going with the pandemic. And so, the vaccines I think that map, California has done well with its vaccination program, early hiccups aside. And we've seen this in other places. The vaccines are proving highly effective in the real world. We thought they would be, they look like they would be, and that has absolutely borne out over time. Places around the world that have had very bad springs, they have much lower vaccination rates than what we have here in California. You hear about the variants in the news and what's going on overseas. We have a lot of the variants of concern have been identified locally in small numbers. The fact is that so far the vaccines that we're using and the data that we have on them, it's very reassuring that they work even with some of these more concerning variants of the virus that have been in circulation. Our risk of healthcare surges is much reduced, especially with our older adults, people over age 50 being vaccinated. Certainly younger people can be hospitalized, and the vaccine will protect them as well. We do see COVID in unvaccinated persons here and around the world. It's not gone away. It will continue to circulate in unvaccinated people. It's not going to go away on its own. I think there's a good chance we'll see increased transmission rates in fall and winter in unvaccinated people. And declining mask use. Masks work great. There are plenty of people who complain about them or feel like they're problematic for some reason, but they actually really do the job. They also kept people from getting sick from all those other respiratory viruses that circulate over the past year. So they absolutely do what they're supposed to do. But we are getting to a place where mask rules are being relaxed because of vaccine. And when we see unvaccinated people not wearing masks indoors, we'll see transmission. That's COVID's around. It'll spread in those settings. And I think that spread will probably be worse in fall and winter. Herd immunity. So what that really means is so many people are vaccinated or immune that even those who are unvaccinated are unlikely to get infected. And unfortunately, we're nowhere near that. I don't think that's going to happen anytime soon. COVID's circulating around the world. There are large unvaccinated populations, even here in Alameda County. So I think the lesson for most people is unvaccinated people will likely be infected sooner or later. Boosters, they may be needed, booster shots, but the more time we have with these vaccines, the better they look. Actually, they do seem to create pretty durable protection. So I'm not sure what the time frame of the boosters will be, or if they'll ever be required, but it's not short term. Maybe sometime in 2022, maybe later, maybe not at all. Next slide, please. So I think the thing that's on many people's minds in this audience is the blueprint update, and it's more than an update. We're in the orange tier right now. I do think we are. It's taken a while because of our spring wave. I do think we're going to hit the yellow tier probably for about a week before the state lifts the blueprint restrictions pretty much completely on June 15th. The latest guidance document on this came out just on May 21st, and it's pretty short, and I encourage you all to read it. The state is going to continue to have restrictions for very large events, more than 5,000 people indoors, more than 10,000 people outdoors. The outdoor restrictions are generally softer, more sort of strong recommendations for the most part. Indoors, there's going to be a test or vaccine or mask type of requirement for those very large events. And the reason for that is it's a lot of people indoors. It's an environment where the virus has proven that it spreads easily. Often people travel for these types of events. You may have people traveling from out of state or even around the world for some of the big events in California. And so they're going to continue to be regulated at least through, I believe, October 1st. And then we'll see. We are expecting additional guidance in the healthcare sector. It's always had its own sort of special set of rules. Schools, the state schools guidance will remain in effect after June 15th and will probably be revised for the fall to reflect where we are today. The Cal OSHA, as I'm sure many of you are aware, Cal OSHA has COVID restrictions that are for worker safety. And they are revising those this week. They've published the proposed revisions. It's a pretty long, dense document, but I recommend you at least be aware that it's out there, and we'll see what happens this week when it gets reviewed and voted on. And so I am expecting some changes. There'll probably still be a pretty high standard for worker safety for the time being in California. Next slide. Just a kind of down and dirty summary. This is straight from the state's own policy statement on Beyond the Blueprint. So when those colored tiers go away on June 15th, as I mentioned, vaccine verification or negative testing is going to be required for those very large indoor events. Strongly recommended for those outdoor events. The state has some pretty straightforward guidance on what's acceptable for vaccine verification and negative testing. It's fairly flexible for those of you for whom this affects your business. Capacity limitations are going away. That's June 15th. No more capacity limitations on the business. You can certainly set it for your own business. Fewer people indoors, especially if you're not certain of the vaccine status of unmasked people in your place of work. Fewer people is probably safer, even when we're at low case rates. But there will not be a state or local Alameda County requirement for capacity limitations. Same with physical distancing. OSHA rules aside, for most business sectors, for attendees, customers, guests, patrons, things like that, there will not be state mandated physical distancing restrictions, nor will there be Alameda County mandates. There will still be some mask requirements. The CDPH has their mask mandate, the California statewide mask mandate. We do not have a local mandate at this time. We just are everybody in Alameda County is subject to the state mandate. They have signaled that for Cal OSHA aside, for fully vaccinated people in indoor settings will not need to wear masks after June 15th, and I expect they're going to follow through with that. So some mask requirements will remain, but they will be lifting, especially for vaccinated people after June 15th. There will continue to be a travel advisory. Those rules are generally not binding, but I encourage people to familiarize themselves with those. Really, if you're unvaccinated and you're traveling, particularly traveling overseas or traveling to places where there's a lot of COVID, be careful. We have a lot of people who have traveled and brought variants back to Alameda County, and it can and will happen. Next slide. So, why is it okay to do this? Well, we're doing great with vaccine in California. In Alameda County, we're over 75% of people. It's actually, the slide's now out of date. It's people 12 and older. We can vaccinate people down to age 12. And making good progress, continuing to increase, hoping to get up over 80, as close to 90% as possible. There's enough people who are never going to get vaccinated that we're probably not going to hit 100%, but we're going to do our best. Next slide, please. Oh, that was it. Okay, so those were the highlights, and I'm sure we'll dig deeper into some of these subjects in the Q&A. Let
me unmute myself. Thank you, Dr. Moss, for that update. All good news that we're looking forward to, and I'm sure we've got lots of questions. Before we get going with the Q&A, I have a question on the yellow tier. So just to clarify, you anticipate that Alameda County could potentially move into the yellow tier next week?
Yeah, so it's been a slow, we've remained at low levels, but slow progress on meeting those criteria. The state checks every week, and we just missed it last week. We had an adjusted case rate of 2.1. We needed to be at 2. You have to meet those yellow tier criteria 2 weeks in a row. So we met it this week. And if we meet it again early next week, then on Wednesday, the yellow tier restrictions go into effect. So that's things loosen up a little bit more, higher capacity limits. And I see no reason why that won't be the case. I fully expect that we will advance to the yellow tier. It'll be the last week that the state does this. They're not going to do it, that week of June 15th. So we'll get a few days in the yellow tier for people to transition.
Okay, thank you. Now, if we'd like to get rolling with some of the questions that are in the Q&A, we'll take turns. Iga, you want to ask the first one?
Sure. Okay. Hot tub guidance for multifamily residential apartment community. They're looking for guidance on opening one.
Sure. Well, this is the kind of rule that's going to go away on June 15th. So on June 15th, it's going to be business as usual, except in any setting where the state face covering guidance might apply. And so you'll be able to resume your 2019 hot tub use. Until then, there are state rules on HOA facilities, but I believe that they are open in the current tier. When I get a chance, I'll try to find that link. I can put it in the chat box.
Great, thank you. Dr. Moss, next question is from Tim Sobrani. He wants to know what guidelines are going to be in effect for youth sports after June 15th, and what restrictions, if any, will be in place when high school athletics starts up again in August. 2 questions. Thank you.
So we are waiting to hear specifics from the state, but my understanding is that the current youth sports restrictions are going to be lifted with the blueprint, and they'll be replaced with some more, I think, flexible guidance. I have to be honest, people don't like hearing this, but sports has been a place where we've had a lot of COVID, hundreds of cases, hundreds and hundreds of contacts. It's not just on the field of play, it's in the carpools, on the sidelines, in the banquets, indoor sports in particular, lots and lots of exposures. Kids, teenagers are getting spread COVID just like adults, and we're seeing plenty of that. So unfortunately, although there are a lot of restrictions in place, a lot of sports are allowed to function, and a lot of COVID has happened in those settings. That'll continue to be the case. For those of you who are in your businesses involved in youth sports, please be on the lookout for these more flexible guidances, and I highly recommend implementing them in your business, and just try to reduce the chance that COVID will spread. Kids may not get severely ill, but they bring it home to their family members and they spread it, and let's try to keep people safe from that if we can. But I do expect most of the rules are going to lighten up after June 15th, and hopefully we'll get more details soon. In the fall, I think we're still waiting to see what the state's guidance says, but I think, again, it'll be similar. There'll be guidelines in place for youth sports, but it'll probably be less than what we have now. And I think there'll continue to be some risk when back to school happens, particularly with indoor sports.
Okay, we have a question here from our local weekly newspaper. Any chance for the kind of spike that we saw this past winter again?
Well, always want to use some caution predicting the future, with COVID in particular, with anything. But with high rates of people vaccinated, and with what we're seeing with the impact of the vaccine locally around the state and around the world, I think the risk of that type of surge, with the severity that we saw and others saw in the winter, is much lower. I think if we saw an increase, it would probably be more like what we saw last summer, or even smaller than that. An increase in cases, small numbers of hospitalizations, potentially some deaths, but not the sort of healthcare surge that we saw in the winter. That's what I'm expecting. I'm expecting some transmission, particularly in unvaccinated community members, and some impacts, but nothing like what we saw this year.
Thank you, Dr. Moss. I have a question from our local transit authority. Any insight on what changes or guidelines will come into effect on June 15th for transit providers? Also, any indication of employees returning to work in office versus working remotely in Alameda or Santa Clara County?
Sure. So I think an important thing for transit is CDC has said this, the state has said this, and expecting this to continue, that mask requirements will continue to be in place for public transit for the time being, even if you're vaccinated. Those are tight spaces. As people start resuming normal life, we're going to get crowded buses, crowded BART trains, and masks will be helpful, especially because not everyone's vaccinated and kids aren't vaccinated. So I do expect that will continue with transit. The state transit restrictions tied to the blueprint are going to go away. So that masking stuff aside, it's going to be business as usual. Now, I think as people go back to work, we should start to see transit numbers pick up, and hopefully Cal OSHA rules will come out, and they may speak to a little bit about worker safety in general that'll apply in transit settings. But otherwise, it's going to look a little bit more like 2019 in terms of not really any specific required restrictions from most sectors. Remote work. So remote work is great if it works for your business and it works for your staff. I think it's going to be very helpful. Probably, maybe more important in winter if we start seeing, as I mentioned, case increases in unvaccinated community members. But I've certainly encouraged people to make use of remote work for their workforce as much as they can. And it won't be required, but I think it has some benefits.
Thank you. Next question is from Maria Mancini. She runs a charitable bingo hall in Livermore and fall under card rooms, 150 to 250 people. Can you talk about the mask requirements when you don't know who is vaccinated and guidelines around food, both brought in from outside and served by the bingo hall? Lots of questions there.
Yeah, so this is, I think, the trickiest thing that a lot of people are having to deal with, which is the state has indicated and CDC has indicated that if you're vaccinated after June 15th, you don't have to wear a mask in indoor settings. But businesses don't really have a good system for determining who's who. So you could implement a system. You could ask people to show their vaccine card, or there are other tools out there that businesses can use, and some are going to use. But that requires staff time and energy. I know it's not a trivial thing. You could require masks of everybody. You could say, look, we have a mixed clientele, and we want to keep this a safe environment, and so we're requiring masks for everybody. But that means that you have to, your staff have to work with customers or clients who don't think they need to wear a mask for whatever reason. And there are not easy answers here. And I think each individual organization is going to have to make that determination. I will tell you, the overall risk right now is low. There's not a lot of COVID around. The risk is probably a little higher depending on who you serve. So if you have a lot of teenagers, unvaccinated, people who haven't had a chance to get vaccinated yet because there wasn't a vaccine, like children, that there's a greater possibility that COVID could circulate in an indoor space. So you could factor that into your decision. But ultimately, businesses are going to need to make a determination on how they want to handle this uncertainty. There really isn't a playbook. We do not have a vaccine passport here in California or in Alameda County. So you'd have to adopt that on your own.
Okay. What are the social distancing requirements in the yellow tier?
Each individual business sector has guidance that the state has published. I'm going to post the link to that site here, and I urge businesses to, if you haven't familiarized yourself with it yet, to familiarize yourself with the relevant industry guidance for your industry. And that talks about how physical distancing should be implemented in your setting. Now, countywide, if it's not otherwise specified, households are asked to keep 6 feet apart from each other. That sort of general rule is in place. But after June 15th, again, most of these restrictions are going away. So those industry rules will remain in place until they're lifted on June 15th. And we in the county are expecting to lift, we in almost all cases point to the state in terms of the rules, and we intend to lift, to move with the state when the state lifts their restrictions.
Okay, it's my turn again. Thank you for that. I have a question. With the economy opening back up and declining mask use, do you think we will go back to a restricted situation at some point? Is it possible or likely or probable?
I think it is unlikely that we'll go back to anything like what we have been living with for the past 15 months or so. And the reason for that is that our health systems, our most vulnerable communities are under much less threat than they were. We certainly still have unvaccinated people in the county that we're trying to reach, get them vaccinated, older adults, people who've had a hard time taking advantage of the various ways to access vaccine. That work continues. But the big picture is that the overall risk is much lower. And as we all know, these restrictions were extremely difficult for people to live with. And harder over time to maintain. And so I think we would, barring some very substantial curveball, much worse viral variant that our vaccines didn't work against, and or some similar situation, we really would not do anything like what we have done. Now, we may increase the mask requirements at some point in winter in certain settings. We may introduce some selective restrictions. Ideally, that stuff would be done at the state level, not at the local level. But really only if we were starting to see substantial increases in cases, for example, next winter, and if we had a lot of people still unvaccinated.
Thank you, Dr. Moss. We have a question from Karen Bruce around navigating children under the age of 1. She's trying to get some clarification on what are the health risks, what are some of your suggestions when you're with children under the age of 1. So we'd appreciate hearing that from you. Thank you.
Great question. Regular viewers may remember that I have a child who was born in September. So this applies to our family. We think about this a lot. It's an unvaccinated person, so a person who can get COVID. And so for when you have unvaccinated people, you just want to think about where the higher risk settings are. So indoor settings where there's lots of people crowded together, people whose vaccine status you don't know. So more public, the grocery store, restaurants, things like that. Those are the places where there's going to be a little bit more risk. Children under 1. Sorry, I think my internet popped out for a second there. Children under 1, probably a little bit higher risk for worse illness than older children. And that's going to especially be true of the first 6 months or so. But I think it is worth being more cautious with children under 1 and just trying to avoid those indoor crowded settings where people have their masks off for the time being, unless you really know everybody in there has been vaccinated. Outdoors, it's going to be pretty low risk. Gathering with other children who are well is probably going to be pretty low risk, particularly outdoors. Certainly daycares, we consider them safe enough to operate. They've been operating almost since the beginning, and so the risk is still generally low. There's not that much COVID floating around right now, but I think it's important for people to be aware, and each of us can make the choice for how we want to handle our families when there are those very young unvaccinated people.
Dr. Moss, thank you. Just if I could add on to that, I have a friend that they're a couple that's trying to get pregnant. And I think her doctor is suggesting that she not get vaccinated because of that, and they've had some challenges with that. So getting pregnant. What are your thoughts about that from a couple that's trying to get pregnant?
Yeah, that's the first I've heard anybody recommend against vaccine for somebody trying to get pregnant. I don't know that there's any evidence to support that, and there's more and more evidence to support the safety of the vaccine and people who are pregnant or and with regard to women's reproductive health. I just only a week or two ago, I looked at the American College of Obstetrics and Gynecology. That's the professional organization of all the OBGYNs in the country. And it's a good resource if people want some no-nonsense, science-based information about reproductive health and the COVID vaccine. There's a lot of confusing or downright wrong information out there on the internet. So that's a good source. CDC has really good science-based information. Generally speaking, safe and recommended for almost everyone. No reason to expect any problems with your pregnancy from the COVID vaccine. And I hope that medical provider, I understand caution, but I think it's worth looking at the most up-to-date information and guidance because more and more data has come out about safety in pregnant women. And by the way, more and more data has come out about the risks of COVID in terms of, preterm birth and other adverse birth outcomes for women who are infected during pregnancy. So, it's just, I think that's the other part of the equation to keep in
mind.
Okay.
Okay, thank you. I'm back. So these technology gremlins, they never get tired. So the next question, and please let me know if this has already been asked. Dr. Moss, what are your thoughts on the use of vaccine passports, and is there a scenario in which they could come into play? Here.
Yeah, this has been a big issue, considered across California at the state level. I think people may be aware the state of New York does have a vaccine passport. Some other countries have implemented vaccine passports. There's no U.S. Vaccine passport. California has not decided to pursue this. I think there's a number of reasons. First is there are some operational challenges. Second, there are some concerns that a lot of people haven't had a chance to get vaccinated. Young people who don't have as good access to healthcare, depending on where you live. There may not be, the Oakland Coliseum Vaccine Distribution Center, Fairgrounds Vaccine Distribution Center near you. And so there's some equity issues around introducing these. On the other hand, it certainly is great for businesses who want to know and protect their staff, institute policies, and I do expect that we may see some private sector solutions that businesses could adopt. I think at this time, we're at a period of deregulation for COVID, of lower risk, high vaccine rates. And so I think it's, and there's only a very small number of things in which businesses will be required to know vaccine status. So that's these mega events that I mentioned. And the state has set a very low bar in terms of what's acceptable proof of vaccination for those events. And you might say, well, everybody's going to cheat. But the fact is that we know, almost 80% of adults in Alameda County have been vaccinated, and there are similar numbers across the region. And in fact, most people are not going to cheat. They're just going to show their vaccine card. So it may be that a low bar is okay in terms of the overall public health goal of limiting the spread of COVID. And so I think that those are, the reasons why it hasn't, there hasn't been a stronger push to do it, and why it probably won't get adopted locally. I think over time, there aren't going to be government restrictions on activities based on vaccine status. Maybe later in the year, in the fall, we'll see those final restrictions fall away.
Thank you, Dr. Moss. Okay, I have one from Michael Roberts. He's with Sunflower Hill. Good morning, he says. Question, do you anticipate it will be necessary after June 15th for the verification of proof of vaccine or negative COVID test for guests to attend a large indoor event? So large is not mega.
So the state has been clear about where their threshold is for indoor events. It's after June 15th, it's 5,000 people. And we're not going to add any restriction locally. I think for event planners who want to, depending on who's attending your event, who want to, be able to say, look, this is the safest possible event we could have, or depending on, what your staff, what you need for your workforce, you could do that on your own. You could require it. You could ask people to show their vaccine cards or find some other solution. But I don't think we're going to see any requirement for any events less than 5,000 people, unless things really change with the pandemic.
Thank you, Dr. Moss. I've got Tracy Fahard with Visit Tri-Valley has a question that she is curious. Following June 15th, what is considered a high-risk congregate setting, and does that affect indoor conferences and weddings under 500 people?
Yeah, thanks for that question, Tracy. I don't think so. I think it's more like homeless shelters, unlicensed residential care facilities with high-risk adults, things like that. The kinds of things that you're talking about, conferences, weddings, that's the stuff that was normally regulated under the state's blueprint. That's going away on June 15th, and unless you're over that 5,000 threshold, the state has indicated that there will not be restrictions, except to the extent that any of the state mask mandate rules still apply. So there may still be a mask requirement for unvaccinated people in indoor settings after June 15th. So those, businesses, as I said, are going to have to figure out how to apply that rule in their settings.
Will children under 8 be required to wear a mask in the fall when school starts in person?
Not sure yet. I think it's a good idea. Children under 8, any children who are unvaccinated, it's a simple tool. I know some people feel like it's not good for children, but I don't think we have the evidence to support that. The only scientific paper that I've seen circulated about this was not, in my professional opinion, was not of high quality and not actually really a scientific paper so much as sort of an article, like a news article almost. So I don't think there's anything to suggest that it's harmful, even though some people have been claiming that, and I think it would have real benefit. But we're waiting to see what the state lands on in terms of their updated school guidance for the fall. That should come out soon, and we generally expect to. Let's see what the state says. I think I understand. Everybody's going to want to get to a place where, if most adults are vaccinated and not wearing masks, having kids wear masks is a tough thing to do. And if schools can be operated safely, then that might be okay. But we'll see what the state recommends, and we do expect, as we have done, to follow the state in most of their COVID guidance locally.
Is it my turn?
Yeah.
Maria Mancini is asking, are people who have recovered from COVID and they have the antibodies but have not taken the vaccine, are they considered vaccinated?
Great question. So far, no. So far, any rules or restrictions that have been set up that are different for vaccinated versus unvaccinated people, they have been with one one notable exception. It's really whether or not you've been vaccinated. It's not whether or not you've had COVID, and part of that is because it's not always easy to determine who has had COVID without some blood testing, and it's different tests from the regular COVID tests. It's antibody testing, and I think that it creates a lot of operational challenges. And also, it's not clear that immunity from natural infection is as potent for many people, particularly if you had mild or asymptomatic infection, as what you get from the vaccines. And so, nobody has, at the CDC or state level, felt like it was appropriate to sort of include those folks. The one exception is some of the rules around quarantine and exposure. If you've had COVID in the last 90 days, then you're not considered exposed again. If you're around a close contact to a person with new COVID infection. So that's one place where in the first 3 months or so after infection, people are considered, immune. But after that, it's you're considered at risk again.
Great. Thank you, Dr. Moss. Martha Espinoza wants to know, are there any known side effects with vaccines for our youth, age 12 to 30, that recently have been starting up? So that's the next question. Yeah. Thank you.
Sure. There are, my understanding from reviewing the FDA materials that I've had the chance to review is that it's that the side effects for youth are similar to what we've seen with adults. Arm soreness, some a day or two of flu-like symptoms, but that nothing really else was seen in the clinical trials. There has been some news reports of what's called myocarditis cases in the reports have been more among young men than other groups after receiving COVID vaccine. So far, the CDC has said that this is something that happens anyways. It's uncommon, but not super rare. It's something I've seen. It's something that happens anyways particularly among young people after viral infections. CDC has said it's not clear that this is happening any more frequently amongst vaccinated people than what you would expect anyways. But there is something but we are monitoring it to see, and the numbers could go up. And that is the only thing that I've seen that's associated with young people that's new, that's been newly identified as a possible side effect. Something that in the cases that have been reported, people have generally recovered from. It's treatable, but something just to be aware of. It is in the news, and that's the only other thing.
Okay. Thank you, Dr. Moss. So all of you who are watching this, do continue to drop your questions in the Q&A, and we have plenty of time still. Inga, I see you have a question, so why don't you ask your question? And I think this is probably something that a burning question for a lot of chamber organizations.
Yes, burning. I would like to know, a lot of our, we've received industry guidance and guidelines and best practices. Post-COVID, post-blueprint, will we be seeing best practices or industry guidance towards events? Because I know, we've talked about the passport and all of that. I mean, are we going to need to put less people at a table? I mean, what are best practices for service and registration desk and hand sanitizer that makes people comfortable?
So thank you for this question, Inga, and we've been we've been working on this at the county, and we actually are going to have some town halls, a community town hall, and then a business specific town hall in the coming weeks. And If we haven't shared that with the chambers yet, Eileen Ng and our COVID recovery team can share the information about how to come, and we're going to take a deeper dive into some of these questions and topics. And so we'll make sure to share the information with you all to share with your various member organizations. The short answer is there's going to be much less. There's not going to be these detailed, documents with that are for this is how you operate a library in COVID. This is what's required of a bowling alley, those kinds of things, or family entertainment center. It's going to be a much more general guidance, and in fact, a lot of it already exists. We're going to point to CDC a lot, which has been providing some of this information all along, more as guidance than these strict state restrictions. I think the state is going to really focus on very high level general rules, such as maximize ventilation, outdoors is safer than indoors. Keep I think they're really not even going to speak to sort of keeping numbers down in certain settings. It's going to be much more general, much more high level, and so we do at the county level. We want to sort of try to help support people to understand what this means and plug some gaps, but we also are not going to be generating specific guidance for industries at the county level as well. We're much more going to point to CDC, point to some broad general rules for folks to rely on, and I think it's going to be up to individual organizations, or maybe working within your organizational networks to determine what best practices make the most sense for your specific business, right? I think, in short, we're trying to get out of the business of telling you how to run your businesses, and that's because things are really different with so many people vaccinated, and there's so much less COVID around right now.
Can I follow up with another question on this, or two?
Sure.
What are our obligations? Will there be contact tracing? Do we need to report COVID cases from events? And if so, what is our liability as a group if it becomes one of those super spreader events? Do you think we should look at insurance?
Yeah. So, the Cal OSHA restrictions will remain in place. I think that there will continue to be a reporting obligation for businesses when you meet those Cal OSHA thresholds. I think it's 3 cases in a 2-week period at a work site. And those may change this week. I don't believe they're going to change. So I think that there will be some reporting requirement, not individual cases. That's the job of medical providers to report individual COVID diagnoses. But if you have a cluster in your workplace, I think you are going to need to continue to report that. And we use the SPOT system, the state's reporting system here in Alameda County. If people aren't familiar with that, we can maybe share the link to our ACPHD website that has the information on SPOT. So that will continue. I can't speak to the liability issues. That's not something I have expertise in, but I urge people to check with their counsel. Some of that may be driven by the Cal OSHA regulations. I have no idea how the courts will interpret, what happens for customers in COVID, but at least from the standpoint of public health regulations, we do feel like it's safer for a lot of them to come away. That doesn't preclude the possibility of a COVID transmission happening here or there, or even a death. That's not the way public health works. We certainly want to eliminate death due to COVID, but we try to make policies and rules that sort of speak more broadly, and we can't rule out we can't eliminate every possible situation.
No, any more questions, Inga? Okay, those are all good because
Of
we're
course I
thinking
do,
about
but
those.
I'll let you go.
Yeah. Oh,
I think there's
okay,
another
thank you.
couple in the
There's
box
more
there.
coming in. They're coming
Yeah,
in.
no,
Yeah.
I was
Go
giving
ahead,
you a
Steve.
hard time. Good. No, this one came in from Michael Roberts again from Sunflower Hill, and this is the question I was going to ask you, and thank you, Michael. Do you anticipate, or have we already seen a rush in new vaccinations due to the new state lottery system that the governor put into place? Has that made an impact?
It's a good question. I've been wondering that myself. I'm trying to pull up the dashboard here on my other screen. So it hasn't been that long, right? You got to read about the governor's announcement, make an appointment, show up. It's only been a few days. I think it was announced on Thursday of last week or maybe Friday. You can look at our dashboard, and if you look at you push the cumulative button, you can actually see a little curve, and there's a blue line, and that is the percentage of county residents who have received at least one dose of vaccine. And if you go on our county COVID dashboard and you look right now, you can see it has flattened out quite a bit over the month of May. Signaling that people are not getting vaccinated at as fast a rate. I'm looking to see if that blue line starts curving up, high and to the right again. That's a sign that there's an increase in uptake. Some of that might be just the 12-year-olds, the 12 to 15-year-olds who only just became eligible, getting their shots. But some of that may be the governor's program, and I certainly hope to see that. It would be great, and I urge people who haven't been vaccinated to take advantage of this the sweeter deal that the governor's offered. By the way, everybody who has been vaccinated in California is eligible to get some of this. Prize money, I guess, whatever you call it. So everybody's being entered into something, even if you already got vaccinated, so you haven't been left out. But hopefully this does push a few people who are on the fence to get vaccinated, and keep your eye on that blue line. Let's see what happens.
Okay, thank you. Yes, there was a question about that. So if we've been vaccinated, then we're entered in the prize drawing. So
that's right.
All right. Will local level city emergency operations be able to conclude crisis mode and designation after June 15th? And is that date determined locally or by the state or the county?
The state has an emergency declaration, the county has an emergency declaration, and then I think I believe the individual cities do that as well. They are separate from the state's blueprint restrictions. So the COVID restrictions are being lifted, but the states of emergency don't have to be lifted at the same time. It's a separate thing. And here in Alameda County, even though rates are down and we feel like the restrictions aren't as needed, the state of emergency is going to remain in place for the time being because it helps us mobilize the resources we need to continue our vaccines programs and continue staffing for, we still have increased workload related to COVID and some other specific response needs that are separate from the business restrictions that remain. Still circulating around the world, still a global pandemic. So I don't have a time frame for when those are going to start being lifted, but it will happen at some point, just not on June 15th.
Mm-hmm.
Individual cities, by the way, may will be making their own decisions, and so this really only applies to the Alameda County declaration.
Mm-hmm. So I have a question on the coordination with county and state regulators having to do who regulate various industry sectors. The restaurant sector, food and bev, barbering, hair salons. There was relaxing. There was some flexibility that was employed during the past 14, 15 months. And I'm just wondering if you have any intel on, are those agencies now looking at, continuing those, continuing conversations with businesses in those sectors to see maybe there are some things that are really working for them that might be extended beyond the COVID pandemic shelter in place emergency orders period. I just would hate to see all of a sudden things that are like, this is actually working pretty good. We like it. And it's helping our business all of a sudden, be eliminated without some discussion that goes on. So do you have any intelligence on that, on those conversations or, deliberations or?
I don't. I don't think you're talking about the blueprint restrictions that are going away, but that are sometimes enforced by statewide agencies like ABC, Alcohol Beverage Commission, would come into restaurants and sort of say, "Oh, you're violating COVID rules." But in terms of other things, where other sort of state licensure or state regulations tied to specific industries they've waived certain things, or they've there's all kinds of adjustments. I know what you're talking about. Healthcare has had a ton. I don't think those, except where they are actually restrictions that are in the blueprint, those are not automatically changed on June 15th. And I think I don't really have a sense beyond that for how individual licensing or regulatory bodies at the state level are going to, change moving forward. I think it probably varies quite a bit from agency to agency. And, at a local level, the health department actually doesn't do a lot of that stuff. So I don't have, except, our own COVID restrictions. We're not a regulator for a lot of businesses at the health department. Our environmental health department is, they regulate restaurants and food preparation. I would just really direct questions about their operations to them, and happy to help provide contact information if that's helpful.
Okay, I would just advocate for a phased pullback of those flexible allowances, like people being able to do takeout cocktails. That was
I think
very
that
popular.
might be a city. That might be.
Was allowed.
I don't know. That might. I'm not sure. That might be city ordinance. So it's worth reaching out to your city managers maybe and seeing what their plans are. A lot of those, a lot of that restaurant, the park, use of public space, throughway stuff. A lot of that stuff, I believe, a lot of that is city. I think there's some fire, stuff in there. I'm not sure if any of the fire regulations were relaxed. And then there's some stuff with environmental health around restaurants, but I would really defer to my colleagues in our Department of Environmental Health just to make sure that I got it right. But I think a lot is local city, and I would check with your city managers, particularly for those, like the open container stuff and the use of the public spaces for restaurants and things like that. I believe that's mostly city.
Outdoor.
Except for
outdoor dining expansions. Dr. Moss, has there been any new information that's been published out there on vaccines for those that are still hesitant, reluctant to, we had some very scientific, very high level medical information that came out early on. And so, there was many factors as to why people are still not vaccinated, but there are groups of people who are still reluctant, they're fearful, what have you. Is there something that's maybe a little bit more, that's been published that is reputable, that is maybe more for the layperson, understandable? You
mean like a resource for information about the vaccines? I think CDC is the best source for this, and this is really their job. They take it seriously. They review the data. I think it's pretty comprehensive, and they do, write stuff for the layperson. Now, I'm not sure, it might. I don't know what they have for in translation on their website, so there may be some issues there for non-English speaking readers. But I think CDC is a very good resource for that. There's a lot out there, a lot of other messaging resources out there. The state has their Vaccinate All 58 website that has information. The Kaiser Family, I think it's Kaiser Family Foundation. It's called Greater Than COVID. They have some materials that are specific to Latino and Black communities, and sort of working with providers from those communities to talk about, share accurate information about vaccines. So those are a good resource for some folks. And then trying to think what else I've pointed to people to. I think it's a good lesson. I should have some of these at hand, because the resources that work for me don't necessarily work for other folks. But it's a good question. I'll see if I can share some things with you, Don, and the chambers to disseminate to your networks, other resources that I think are credible. There's a lot of, the internet is full of bad information. That's why I like pointing to CDC. It's really thoroughly, it's very good information. Of course, people's medical providers also, one thing that we've learned about people who are not quite ready to get vaccine is that many of them trust their medical provider more, the most of all, to give them the best information for them. And so people who have a medical provider who aren't sure, absolutely call your provider up, have this conversation, and by and large, you're going to get very good advice.
Okay. Thank you.
Okay, we have a question here from Razi Hosni. Will the state or county expect us as owner-operators to verify vaccination status for attendees at restaurants, gyms? What are common practices that you've seen from other states or countries?
So vaccination status right now, after June 15th, with the removal of the state restrictions, unless you're doing those events, those mega events, 5,000 people indoors, 10,000 people outdoors, there isn't going to be a state or local requirement that you determine the vaccine status of people attending restaurants or gyms, most other businesses. And so you don't have to do it, although again, in terms of the mask, the mask requirements are going to be different for vaccinated versus unvaccinated people, and there isn't really a system in place from the state or from the county to do that. You have to determine how best to do that for your business. I think we talked a little bit earlier about the vaccine passports. That's been a solution that some countries have gone with. Some counties in the state have explored that. I think there are difficult challenges with implementing those things at the county level. I think if you want to ascertain people's vaccine status, I honestly think simple is best. Bring your card, and you could incentivize that some way. 10% discount if you bring a vaccine card, something like that. Beyond that, there isn't one thing I could point you to that I know is going to work great for businesses. And I'm sorry, but this is going to be a challenge, and it's going to be a challenge that will continue as long as those differential masking requirements are in place.
Thank you, Dr. Moss. I think this was asked last time we talked with you. Patty Pringle wants to know whether we need a booster vaccine? Will that be required? I've seen some recent information that it looks like we may not need one for some time. So love to hear your thoughts about that. Thank you.
Yeah, I think it's, I've been telling people they might be needed, and I think that's a prudent thing for somebody in my role to say. But to be honest, so far, we haven't seen any evidence that suggests that they are absolutely going to be needed or what time frame that'll be. There's good vaccine response from the people who have had the vaccine, both in terms of what you see in the real world with infections, and also when you do tests to see, how strong people's immune response is. It seems to last for months, even up to a year in some cases. A very small number of people were vaccinated over a year ago at the very beginning of the clinical trials. We're starting to get information from them. And so far, all of that's been very encouraging. Again, boosters maybe at some point. For the short term, no. It seems like the vaccines are pretty strong. There's different types of vaccines out there, and there's different types of vaccines used overseas. It may be different for different vaccines, but for right now in the U.S., I think we're still cautiously optimistic we're not going to need them in the near term.
Do you want me to stab that?
Yeah, go ahead.
Okay, let's talk about travel restrictions. What's recommended? What's mandatory? Vaccinated, unvaccinated? What's technically a safe distance for anybody in general to travel? I mean, if you want to get away for a day, are you saying staycations as far as maybe Santa Cruz type of, what's an idea on that? And then what's recommended for state to state, and then recommended for out of the country? And then can you use your crystal ball and give us an idea of what countries should be avoided through the end of the year? Or is that a fair question?
Yeah, okay. There's a few things here. So first of all, the state has a travel advisory that generally mirrors the CDC's travel advisory. And the most important thing is it's still recommended that unvaccinated people not travel. And the reason for that is there's a lot of COVID. You saw the map. I think I showed it earlier. There's a lot of COVID in the U.S. There's a lot of COVID around the world. And there's not a lot of COVID here. So if you travel, you might get COVID and bring it back and introduce it into our communities. And we really want to avoid that. So get vaccinated. Then CDC has said it's okay to travel. The state has said it's okay to travel. And I think that's sound advice. I think people who are vaccinated should certainly feel safe traveling. Regardless of whether or not you're vaccinated, if you're thinking of traveling overseas, I would. The CDC has a travel page. It's a great resource, even in non-COVID times. What you need to do to stay safe when traveling around the world, and it tells you where COVID is circulating, and you might consider not traveling to those places, even if you are vaccinated, just to be on the safe side. We know that occasionally people who are vaccinated do get infected. Why roll the dice? Go somewhere where there's less COVID. So that'd be my advice. I think that's a safe thing to do. I believe you still have to get tested to travel, to return to the U.S. If you travel overseas, if you're not vaccinated. And so there is some testing done to try to protect COVID from being brought back in with travelers, but it's not perfect. And I think going to places where there's less COVID circulating makes the most sense. A little hard, if you're planning a trip for the fall, it's a little hard to know in advance where COVID's going to be circulating. Winter's probably going to be worse than summer. So, if you're going to plan a trip for the summer, maybe look at the Southern Hemisphere where it's going to be summer there. If you're planning a trip for the winter, COVID probably going to be transmit more easily in winter months. And so, so maybe that's helpful in trip planning. I think unvaccinated people, certainly, traveling around the state, probably pretty low risk. But there's COVID is out there. And as I said, if you're unvaccinated, you're going to get it sooner or later. And if you travel someplace where there's COVID around, it might be sooner. I think for vaccinated folks, traveling around California, even around the States, really is very low risk. Families with children, I think it's more complicated, like we were talking about before, and you want to think about a trip where, what spaces your kid's going to be in, where you're going to go. So we're going to do a road trip with our child this summer. We're not going to be in a lot of indoor crowded spaces on that trip. We've designed the trip that way just to be on the safe side, but we're going to travel and we'll travel out of state. So I think it can be done. You just, you want to think about it if you have unvaccinated kids with you.
Thank you. This is a question.
Can I add one thing? Sorry.
Oh, sure.
Sorry, Steve.
Yeah.
There are no required, besides some of the testing requirements with coming in from other countries, there are no requirements for travel. Most of that is strong recommendations. There's no mandatory quarantine. There's a suggested quarantine. I urge people to read the state travel advisory, California Department of Public Health COVID travel advisory for details, and I'll post it in the chat. Sorry, Steve.
Hey, that's okay. No problem. The next question is something that I had a debate with my brother on. He was kind of concerned about when he went to get vaccinated. It's the form that he was given said it was emergency use, that it had not been approved by the FDA. So can you bring some clear discussion to help some of our viewers on that? That'd be great.
Yeah. So people may know we have a pretty strict medication safety regulatory system in place in the U.S. So I think maybe the most strict in the world, stricter than Europe. And you have to jump through a lot of hoops to get drugs approved by the FDA. Medical devices, less so, but drugs, very, very high bar. And in order to get full approval, you have to do a lot of things. You have to show a lot of safety with your product, and then you have to monitor your product after it's being used out in the public, post approval monitoring. Emergency use authorization is a way to get a very important medications or very needed medications out before they reach full approval. And they still need to have they still need to meet all the same safety requirements. And I'm not an expert on this, but as I understand it, they don't need to complete the full trials. They don't need to complete the full phase 3 clinical trial of safetyness and efficacy, as long as they can show in enough people over enough time safety and efficacy. And that's exactly what happened with the COVID vaccines. They got very large trials together. FDA said with 2 months of data from these large phase 3, remember there's phase 1 and 2 as well, phase 3 clinical trials, you can get emergency use authorization because it's a global pandemic. And so that's what happened. But they have to complete those trials, complete the analysis, make sure that everything is still consistent with what was seen earlier before they can go back for full approval. And it's a slow process, highly regulated. My understanding is Pfizer and Moderna are going for full approval later this summer. That's happened. It just takes more time. But the reason this process is in place is it actually started with HIV and HIV medications. People were dying, and same was happening with COVID. People were dying, and so the emergency use authorization pathway is there to get things out when you have that sort of most important key efficacy and safety data in place already, so that you don't have people dying unnecessarily.
Okay, thank you, Dr. Moss. I know we have a few minutes left here, so get any of your last minute questions into the Q&A and we will ask those of Dr. Moss. I do wanted to note, Dr. Moss, and you mentioned it earlier, that you have a couple of, workshops that you're publicizing on your website. June 15th, community-based Beyond the Blueprint update, and on June 21st, employer-based Beyond the Blueprint update. And people can register for those. I guess they're webinars. I've already registered for both of them. And is this is where the county explains the adjustments or the changes to the restrictions, right?
It's me,
Or
your favorite
you.
local long-winded health officer. So it'll be me. It'll be some other colleagues, the Berkeley health officer. I just posted the link to our Beyond the Blueprint webpage that Don is reading from that has the details in there. And yeah, we'll talk through. It'll be very similar to this conversation, but hopefully a little more structure. And where I was vague, maybe I'll be more concrete.
Mm-hmm. Mm-hmm.
And we'll hopefully have more of the information about Cal OSHA at those town halls.
Yes, yes. So that will be our next issue that we'll be educating folks on as that unfolds. It's giving some businesses some angst here. So, but again, it's temporary. So we just need to have our input and see what that looks like and implement that through the remainder of the year. One final question for me, and it's kind of a goofy one. So is buffet food service going to be okay again after June 15th? Do you know?
Say it again, Don.
Buffet food service.
Oh.
Will that ever make a comeback after June 15th?
You know, I think it's probably the buffet is probably not as risky as we thought in the early days. Of course, everybody, it's good practice. Wash your hands before and after you eat a meal. You know, you fill up your plate, go to the table, use some hand sanitizer, clean up. It's always good practice. But it's really people without their mask on. That's probably much riskier than handling the soup ladle. And so I think, you know, as there's less COVID around and more people vaccinated, in fact, people are going to be able to use the buffets, but different people are going to move at their own pace, and different businesses will move at their own pace, and that's okay.
Okay.
It's the bar nuts
Right,
that you have to worry about.
Oh, yeah. Infectious disease doctors don't like bar nuts.
Yeah, everybody gets their own bowl. I have a question. Of course, I forgot it, so I'll ask Tracy's. Will the vote by Cal OSHA affect businesses with less than 10 employees? Do you know?
Oh, actually, I don't know the answer to that. I thought it did, but I confess I don't recall reading that. For those of you who haven't read them, the Cal OSHA webpage and documents and regulations are pretty dense.
Okay. And there's another one. Oh.
I would say, if in doubt, I would follow the Cal OSHA regulations, if in doubt, and ask your counsel.
Yeah, you've probably seen this, Dr. Moss. Razi is inviting you to come to the Tri-Valley in person, and he wants to host you for dinner, a workout, or a yoga session. What do you say?
That sounds terrific. I appreciate the invitation. I very much look forward to coming to an in-person meeting with the chambers sometime soon. I think it's, you know, we are going to be there before you know it. So thank you for the invite, and absolutely.
Okay, awesome. So we have some.
Although I can't receive any gifts, just keep that in mind. I have to pay my own way.
Okay, so we have one last burning question related to the vaccine here. I want to get in here. We're getting lots of thanks and notes of appreciation for the webinar. What happened with the Johnson & Johnson vaccination, and how do we know the same will not happen with Pfizer and Moderna?
Yeah, good. Another good question. So Johnson & Johnson appears to cause this a very unusual, rare syndrome where it causes blood clots and low platelets in some recipients. About overall, it's I think I haven't seen the latest figures, something around 1 in a million. But in women who are reproductive age, women under age 50, it's more common, maybe 1 in 100,000 or so. And so it's very low risk compared to COVID, and COVID itself can cause terrible health effects. But it is the most substantial safety signal we've seen from any of the vaccines approved in the U.S. And it's something for people to be aware of. We continue to use Johnson & Johnson. It has an important role, works great, works against some of the, we have data showing that it works against some of the variants of concern that are out there. And it's one dose. And some people that's really important. They only want to get stuck with the needle once if they can help it. And so it has a role, but it's important for people, particularly women in that age group, to be aware that there is this rare but not zero risk of this clotting syndrome. And there have been a couple deaths in the U.S. from that. So that's the Johnson & Johnson story. Still a good option, but I think, with that information, some people have chosen to receive one of the other vaccine types. There's nothing like that so far that has been observed with Pfizer and Moderna. Hundreds of millions of people, maybe in the U.S. now, have received those vaccines, certainly worldwide. And so we have huge amounts of information. Many, many people have received those safely, and even Johnson & Johnson, millions of people have received that vaccine and safely. So these are very rare outcomes, but it has been noted with Johnson & Johnson. I mentioned the myocarditis thing. It's inflammation of the heart muscle earlier in the call. That's the thing that again, CDC has said it doesn't appear to be any more common than you would expect, but the case reports that have come in with associated with Pfizer and Moderna. It took hundreds of millions of people receiving those vaccines before that even became a suggestion of a signal. So again, we're talking about things that are much, 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 much less riskier than the risk of dying of COVID for anybody, even younger adults. So they're very rare, but that's the Johnson & Johnson story. Nothing like that. Nothing that severe has emerged with the Pfizer and Moderna vaccines.
Okay. So
Can you follow-
time is drawing near. Inga, does that answer your question there about the J&J? Yeah.
Well, I just think that maybe you should qualify it, because it seems like there's these medicines that people take for cholesterol or heart disease. Some of them have these conditions, like you take pills to fix the side effects of this one. I mean, can we compare? This seems like J&J is a super low risk compared to medicines that people take for lots of conditions. Does that make sense?
Yeah, that's a great point. And thank you for making it. Vaccines are always kind of held to a higher standard for some reason. But obviously people who are already sick, they already have a problem, as opposed to people who are taking something to prevent a problem. The internal calculation is different, but you're right. Actually, many medications that people take every day without thinking and take for years, decades even, have much higher rates of adverse outcomes than anything we're talking about with these vaccines. They are extremely safe. Even Johnson & Johnson, not zero, but extremely safe. The Pfizer and Moderna vaccines are extremely safe when you consider the number of people that have received these and the fact that we've really seen no safety signal that is highly concerning from them. So yes, you are correct. People take stuff all the time. That's much more dangerous. Having a couple drinks and jumping in the car is way more dangerous than any of this. And so, it is helpful to keep it in perspective. But people have always held vaccines to a higher standard, and it's something in public health that we're constantly, trying to educate people around.
Because doesn't the birth control pill give you the chance? Sorry, doesn't the birth control pill give you greater chance of blood clots? Just saying.
Depends on the pill type, but there are birth control and cigarette smoking and certain other things are associated with blood clots. You're right. Usually different. This is a very specific and unusual thing that we see with the Johnson & Johnson. Again, it's extremely rare, but yeah, you're right. That's right.
Okay. So, Dr. Moss, thank you again for your time. We want to be respectful of the time. It is now 1:01. Again, thank you. And perhaps the next time we see you, it will be at an in-person event here that we will host. So, but we will just hold that thought, stay positive. Dr. Moss, do you have any final closing words to wrap up here?
Just, it was great to be here. Great questions. If I answered anything vaguely or you want follow up, please let me know, or Don or Inga or Steve, and we'll get an answer for you. And I just wanted to echo what Don said before. We really appreciate the partnership and really looking forward to a time where public health is more in the background, helping keeping people safe, but not interfering so much in everybody's daily life.
Okay. So thank you to you, Dr. Moss, and to all you do and your team there at the Public Health Department. Thank you to our CEOs, Inga Houston and Steve Van Dorn, and of course to Amos Productions for producing this event. And everyone, this video will be posted on our website. Give us about a day or so to get it all queued up for you, and then you'll be able to watch it again or share it with your friends. All right, everyone, thank you and have a great rest of your day. See you on June 15th.
Thank you, Don.
Thank you, Dr. Moss.
Thank you, Dr. Moss.